Let's begin our topic of infectious medicine, which is the subdural empyema. And in the first section of our lecture, we will talk about the epidemiology of subdural empyema. What's the etiology? What are the different factors or causes of the subdural empyema, and also the pathophysiology of the subdural empyema. So subdural empyema is a collection of pus between the dura and arachnoid matter or arachnoid membrane. The meninges are the coverings of the brain and spinal cord, and these are three layers or three meninges. We have pia mater, arachnoid matter, and the dura matter. So the subdural means below the dura, so it's the collection of pus. Empyema is the collection of pus or presence of the pus between the arachnoid matter and the dura matter. Subdural empyema. So we have pia matter, we have arachnoid matter, then we have dura matter. So subdural is the between the arachnoid and the dura matter. You can see subdural empyema here is the collection of pus. This is the dura matter, which is attached to the skull. This is subdural, so below the dura. This is the dura matter. Then these are the lateral ventricles, brain parenchyma, superior sagittal sinus, subdural space, cranial bone. So the meninges, we have three meninges, and the presence or collection of pus between the dura mater and arachnoid matter is subdural empyema. Now, the epidemiology of subdural empyema, it's a rare disorder. It's not very common condition. Subdural empyema accounts for about 15 to 25% of cases of focal suppurative central nervous system infection. So of all the central nervous infections, the subdural empyema accounts for about 15 to 25% of the cases. Common predisposing conditions of the subdural empyema, the sinusitis, involves the frontal sinus mainly, and alone or in combination with ethmoid maxillary sinus. So sinusitis is the inflammation of the sinuses. When the sinuses are inflamed, these are the empty spaces filled with the air. So when the lining of the sinuses get infected or inflamed, that infection can go to the brain and cause subdural empyema. Usually the frontal sinus is affected in the frontal bone here, but sometimes it can be associated with the ethmoid and maxillary sinusitis. Sinusitis associated empyema, predilection for young males. So sinusitis associated subdural empyema is more common in young males. Reflecting sex-related differences in sinus anatomy. It's more common in young males. The reason for that is there is difference between the anatomy of the male and female sinuses that can cause increased chances of sinusitis and then the subdural empyema in the young males. Difference in the sinus development. So all these are different predisposing factors that can cause subdural empyema. Sinusitis is an important contributing factor. The sinusitis is more common in the young males that can lead to subdural empyema. may complicate 1 to 2% of cases of frontal sinusitis severe enough to require hospitalization. 3:1 male to female predominance or ratio. So there is quite a big difference. 3:1. 3 males are affected, 1 female. The ratio is 3:1. 70% of the cases in second and third decade of life develop as complication of head trauma or neurosurgery, secondary infection of subdural effusion result in empyema, and secondary infection of hematomas, which is rare. So the causes can be, it can develop subdural empyema as a complication of any surgery performed on the brain or any head trauma. It result in empyema, and it's as a result of secondary infection of the subdural effusion, it can result in empyema. The etiology or causes of subdural empyema, aerobic and anaerobic streptococci can cause subdural empyema, staphylococci, Enterobacteriaceae, anaerobic bacteria, gram-negative bacilli. All these are very common causative organisms that can cause subdural empyema. Streptococcus, staphylococcus, they can cause sinusitis very commonly, and sinusitis is one of the predisposing factor, so it can also cause subdural empyema. 1/3 cases are culture negative, reflecting difficulty in obtaining adequate anaerobic cultures. So they are culture negative. About 1/3 of the cases we cannot develop, they grow these microorganisms. So it's hard to find the causative organism in these cases. Pathophysiology of subdural empyema. It can be due to retrograde spread of infection. This infection that can go backward from sinuses, and different infections can involve the subdural area. From septic thrombophlebitis, of mucosal veins draining sinuses, contagious spread of infection to the brain from osteomyelitis in posterior wall of frontal or other sinuses, direct introduction of bacteria into subdural space as a complication of neurosurgical procedure. So different factors can contribute to the subdural empyema. Infection from the different areas can be retrograde spread or from the contagious spread of infection to the brain, and from the osteomyelitis in posterior wall. Different infections can spread to the subdural area and cause empyema or formation of abscess or pus, or it can be direct invasion of the bacteria into the subdural space, or as a procedure, neurosurgical procedure that is performed, it can cause infection. Evolution of subdural empyema is extremely rapid. It can spread or evolve very rapidly. Sinusitis associated subdural empyema. Suppuration typically begins in upper and anterior portions of one cerebral hemisphere, then extend posteriorly. So the suppuration, sinusitis associated subdural empyema, the suppuration usually begins in upper and anterior portions of one cerebral hemisphere, and then it can spread posteriorly. Subdural empyema associated with other intracranial infections. You can see the pus formation. So other central nervous system or intracranial infection, we have epidural empyema, 40%. Cortical thrombophlebitis, 35%. Intracranial abscess or cerebritis is in 25% cases, more than 25. So all these are associated central nervous system infection, thrombophlebitis and epidural empyema. We will also discuss these two conditions because subdural empyema is very commonly associated with these intracranial infections. Cortical venous infarction produces necrosis of cerebral cortex, subcortical white matter. That was all about section 1. Thank you for watching sqadia.com.